Welcome to Screening for Suicide Risk, module for the Behavioral Workforce Initiative Seminar. My name is Laika Ginaldo, and I am a PhD candidate as well as a licensed independent clinical social worker. Within this module, our objectives include 1. Describe suicide risk screening and being able to differentiate it from suicide risk assessment. 2. Discuss validated instruments that are available for suicide risk screening. 3. If there is anything that I really hope that you take away from this module, it is that you ask suicide risk screening questions. And I'm going to rely on the Mayo Clinic public service announcement to help meet this objective. Okay, so suicide screening, what is it and how do you do it? So by definition, suicide screening is a procedure in which a standardized instrument or protocol is used to identify individuals who may be at risk for suicide. How do you do it? The implementation of suicide screening can be done independently or as part of a more comprehensive health or behavioral health screening. It can also be done orally with the screener asking the questions with pencil and paper, or in some instances using a computer or an iPad. So suicide assessment, what is it and how do you do it? So by definition, a suicide assessment is a comprehensive evaluation done by a clinician to confirm suspected suicide risk, estimate the immediate danger to the patient, and decide on a course of treatment. How do you do it? Basically, the implementation of a suicide assessment can involve structured questionnaires and open-ended conversation with the patient and/or friends and family to gain insight into the patient's thoughts and behavior, risk factors like access to lethal means or a history of suicide attempts, as well as looking at protective factors like immediate family support, in addition to medical and mental health history. Now, I'm going to introduce several validated instruments to meet Objective 2. Now, the first screening instrument is the Ask Suicide Screening Questions, which was developed by a team led by Dr. Horowitz, who is a psychologist in the Office of the Clinical Director's Office at the National Institute of Mental Health. This instrument was led by Dr. Horowitz and was an interprofessional team that included social workers, epidemiologists, psychiatry as well. So this screening instrument is called the ASQ. It has 4 items, of which the responses include yes or no. The administration time is less than or equal to about 2 minutes. And the scoring time is less than or equal to 1 minute. Now, this specific instrument has been validated within an adult inpatient setting, pediatric emergency departments, and is currently being validated in pediatric inpatient settings and outpatient settings as well, to include primary care. Now, this specific instrument is available in the public domain, meaning that it's available for free and downloadable. Now, this specific instrument was designed to be administered, scored, and interpreted by non-mental health clinicians. So this oftentimes includes physicians or nurses. This is the actual screening, Ask Suicide Screening Questionnaire. Number 1 is, in the past few weeks, have you wished you were dead? Yes or no. Number 2, in the past few weeks, have you felt that you or your family would be better off if you were dead? Number 3, in the past week, have you been having thoughts about killing yourself? Yes or no. And have you ever tried to kill yourself? Yes or no. If the answer is yes to number 4, then you would ask questions like how, as well as when. Now, question 5 is asked in the event that the patient answers yes to any of the above questions, which was 1 through 4. And this question is to determine the acuity of the suicidal thoughts. So the question is, are you having thoughts of killing yourself right now? Yes or no? The second validated instrument that I would like to talk about is the SIQ, or the SIQ Jr, which was created by Dr. Reynolds. It is the Suicidal Ideation Questionnaire. Now, there are 3 adaptations of the specific questionnaire to specific populations. So the first adaptation is the 25-item ASIQ, which is for adults equal to or greater than 18 years old. The 30-item version of the SIQ is for ages 12 to 18, and then there's a 15-item adaptation for youth ages 10 to 14. And some of the constructs in this instrument including wishing to be dead, method like a specific plan or intent to act, and behavior like preparing to end your life. And the responses on this instrument are on a Likert scale. The average administration time is about 10 minutes. Scoring time can range between 5 and 10 minutes. It's available in 2 country-specific languages and available in the private domain. The cost of the instrument is $62 for a pack of 25. Now, this specific instrument has been validated with college students, adolescent suicide attempters, depressed adolescents, adults in the emergency room for psychiatric reasons, adult psychiatric inpatients as well as outpatients, and this specific instrument was designed to be administered, scored, and interpreted by mental health professionals. Now, the third validated instrument that I wanted to introduce includes the C-SSRS, which was created by Dr. Posner. Now, this is the Columbia Suicide Severity Rating Scale. So this specific instrument includes 6 items, looking at different constructs like wish to be dead, method like a specific plan or intent to act, and behavior like preparing to end your life. And again, the responses to this questionnaire are yes or no. It's available in 114 country-specific languages. It's been validated with adolescent suicide attempters, depressed adolescents, adults in the emergency department for psychiatric reasons, as well as adult psychiatric inpatients. Now, this specific instrument is available in the public domain as well, available free of charge via download. And mental health training is not required to administer this test, so various professionals can administer this scale, including physicians, nurses, psychologists, social workers, teachers, and clergy. And this is the C-SSRS, so you'll notice that ask questions that are bolded and underlined. So you start with the first 2 questions, which is, have you wished you were dead or wished you could go to sleep and not wake up? Yes or no. Number 2 is, have you actually had thoughts of killing yourself? Yes or no. If the patient answers yes to 2, then you are supposed to ask questions 3, 4, and 5, and 6. However, if they answer no to number 2, or answer no to the 2, then you go directly to question 6. So question 3 is, have you been thinking about how you might kill yourself? Question 4 is, have you had these thoughts and had some intention of acting on them? Number 5 is, have you started to work out or worked out the details of how to kill yourself? Do you intend to carry out this plan? And number 6 is, how long ago did you do any of these? Now, to meet the third objective, I'm going to rely on the Mayo Public Service announcement to help meet this need.
I have my ups and downs, just like anybody else.
Maybe more than anybody else.
I can be hard to figure out.
And I like my privacy. I don't want you looking over my shoulder all the time.
But you know your kid better than anybody else. And if you think he's acting different than usual,
Acting really down, crying all the time for no good reason.
or getting really mad, not able to sleep, or sleeping too much,
Shutting her friends out or giving her stuff away.
acting reckless, drinking, using drugs, staying out late,
Suddenly not doing stuff he used to love.
or doing stuff that's just not like him.
It might be nothing to worry about. It might just be high school.
Or it might be something more. He might be depressed. Not just feeling down, really depressed.
It might be that your kid is thinking about killing himself. It happens. More than you think. More than it should.
And people say I had no idea.
I thought it was just a phase he was going through.
I never thought she'd do it.
I wish he'd come to me.
I wish he'd said
I
something.
wish I'd said something.
When it's too late. So if you think your kid's acting different, if she seems like a different person, say something.
Say, what's wrong? How can I help?
And ask straight out. Are you thinking about killing yourself? It doesn't hurt to ask. In fact, it helps.
When people are thinking about killing themselves, they want somebody to ask. They want somebody to care.
Maybe you're afraid you'll make it worse if you ask. Like, you'll put the idea in their head.
Believe me, it doesn't work that way.
It doesn't hurt to ask. In fact, the best way to keep a teenager from killing herself is to ask, are you thinking about killing yourself?
And what if they say yes?
Or maybe.
Or sometimes.
Well, here's what you don't say.
That's crazy.
Don't be such a drama queen.
You're making too much of this.
That boy's not worth killing yourself over. That's not going to solve anything.
You're just trying to get attention.
You're not going to kill yourself. What you do say is,
I'm sorry you're feeling so bad. How can I help? We'll get through this together.
Let's keep you safe.
a lot of people think about killing themselves. Adults and kids. Most of them never try it, but some of them do. So if your kid says,
I'd be better off dead. I can't live with this.
I'm gonna kill myself, take her seriously. Find someone she can talk to about it. Someone who knows how to help.
Sometimes kids want to kill themselves because something happened. A breakup, a failure. But sometimes it goes deeper, and it's not going to go away by itself. Get some help. Talk to your doctor.
Or a counselor at school.
Or your minister.
But don't just let it drop.
And make sure that your kid always has someone to turn to. Someone he trusts. Make a list together, right then. 3, 4, 5 names.
Put a suicide hotline number on there too.
Have him keep that list in his wallet, so he always knows where to turn.
Make sure your home is safe. If you have pills she could use to hurt herself, lock them up.
If you have a gun, don't just lock it up. Get it out of the house. The bullets, too.
And one more thing. If you think your kid might be about to hurt himself, don't leave him alone.
Take him to the emergency room.
Call 911 if you have to.
We all have our ups and downs, but sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask. Ask straight out. Are you thinking about killing yourself?
Don't wait until you're sure. Trust your gut, because it never hurts to ask.
And it can make a big difference. All the difference. In your kid's life.
All right, so in summary, we've basically done 3 things in this module. Number 1, I talked about suicide risk screening. Number 2, I introduced and discussed validated instruments, which included the As Suicide Screening Questionnaire, the Suicidal Ideation Questionnaire, as well as the Columbia Suicide Severity Rating Scale. And then we looked at the Mayo Clinic PSA to really encourage everybody to ask suicide screening questions. So that being said, we will continue this conversation in class, and we will demonstrate and role play how to use a validated instrument using the Ask Suicide Screening questions, as well as discuss my clinical recommendations of assessment and screening, and what to do when you have a positive screen for suicidal risk. I look forward to meeting all of you. Thank you for viewing this module.